Many parents are concerned about their child's mental health because of remote schooling. A new Vanderbilt Child Health poll found that more than half of parents surveyed worried about their child's lack of social interaction. Parents reported an increase in concerns about their child suffering from anxiety or trauma reactions. The study also showed that a larger number of minority students were in remote learning environments compared to their white peers. Parents from low-income households reported more undiagnosed anxiety, depression, or stress in their children. Schools provide critical infrastructure for access to mental health for many children. Kids can be cut off from important health and social services when schools go remote. Researchers recommend schools partner with community mental health programs and apply for any additional funding to increase student engagement. Children under stress may show several symptoms such as regression in their behavior or separation anxiety. Signs that a teen may be struggling can include breaking rules, failing grades, experimenting with drugs, or having suicidal ideation. If you see signs of suicidal thoughts, please take it seriously. You may need to seek professional help. I'm Bill Prasad, your mental health and wellness expert.
The National Suicide Prevention Hotline is free to call, available 24/7. That number is 1-800-273-TALK.